Welcome to episode 69 of Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're exploring homeostasis of blood volume, blood pressure, and body osmolarity. Three interdependent factors crucial for maintaining circulatory and cellular stability. By the end of this episode, you'll understand how the cardiovascular, endocrine, and urinary systems regulate blood pressure and volume, and how the body responds to dehydration and hemorrhage. So let's get started. Blood pressure is directly influenced by blood volume. When blood volume drops, whether due to dehydration or hemorrhage, the body must compensate to maintain adequate circulation and oxygen delivery. Dehydration results from water loss alone or water and solute loss, such as from sweating or diarrhea. Hemorrhage, on the other hand, causes proportional loss of water and ions, meaning osmolarity remains unchanged. When blood volume drops, multiple systems work together to restore homeostasis. In the cardiovascular system, increased heart rate and stroke volume will occur to maintain cardiac output. Increased total peripheral resistance through vasoconstriction to raise blood pressure. Baroreceptors will detect low blood pressure and activate the sympathetic nervous system. With the nervous system, it will increase sympathetic activity to enhance vasoconstriction and cardiac output. It will also decrease parasympathetic activity, which removes inhibitory effects on heart rate. Then there's the endocrine system. The renin-angiotensin-aldosterone system is activated. Renin is released due to low mean arterial pressure. Angiotensin II is activated, which increases vasoconstriction and thirst. And aldosterone release causes an increase in sodium reabsorption, which promotes water retention. Vasopressin is also released, which promotes water reabsorption in the collecting duct. And this increases blood volume while decreasing osmolarity. Finally, epinephrine and norepinephrine are released, and these both enhance vasoconstriction as well as increasing cardiac output. In the urinary system, water reabsorption is increased to conserve fluid, while urine output is decreased to maintain blood volume. Now, when dehydration is due to water loss only, such as excessive sweating without electrolyte loss, extracellular fluid osmolarity increases, which triggers the release of vasopressin to promote water retention. However, aldosterone release is reduced to prevent sodium retention. Additionally, thirst is increased to restore fluid balance. Now, blood loss decreases both water and ion levels proportionately during hemorrhage, so osmolarity remains stable despite a decrease in blood volume. The immediate response is the activation of the renin-angiotensin-aldosterone system to restore blood pressure and volume. Vasopressin will increase water retention, and the increased thirst helps replenish lost fluid. There is a delayed response where erythropoietin release occurs to stimulate red blood cell production over days to restore oxygen carrying capacity. This process is unique to hemorrhage and does not occur in simple dehydration. So to summarize, blood pressure regulation is a coordinated effort between the cardiovascular, endocrine, and urinary systems. Dehydration increases osmolarity, which triggers vasopressin release and reduces aldosterone secretion. Hemorrhage reduces blood volume without affecting osmolarity, which requires the activation of the renin-angiotensin-aldosterone system, as well as the release of erythropoietin. Rapid compensatory mechanisms restore blood pressure, while longer-term responses, such as erythropoietin release, restore blood composition. And so that's it for episode 69 of the Pulse of Physiology. I hope this episode has clarified how the body maintains homeostasis of blood volume, blood pressure, and osmolarity. Come back next time for episode 70, where we'll explore acid-base balance and how the body maintains pH homeostasis. Until then, keep questioning, keep exploring, and stay curious.